You said go.
Oh, yeah, we're good.
Okay, we call the Health Services Committee to order. First, I need an approval of the previous minutes. Have a motion to approve the or Supervisor Bruno, second. Supervisor Gilligan. All in favor?
Aye.
Opposed? Okay, privilege of the floor. Anyone from the board or the floor have anything to comment on? Okay, listen, we're gonna start with Office of the Aging. D isn't here, and all we've got here is a summary. If anybody has any questions on the summary, please let me know now. If not, we'll ask for a motion to approve. Oh, we don't need it. FYI, God love her. All right, I think we'll go to Rob next then.
Okay, morning, everyone.
Morning. Morning.
I'd like to introduce Harry Carlson. For those of you that don't know Harry, Harry is Deputy Director of Fiscal for our office, and he does everything fiscal for us. And he's prepared our budget this year and also a handout table that you should have in front of you. We just handed out the one pager there. This is kind of a summary sheet that shows our administrative expenses and then our various contracts with the local not-for-profit agencies. A little bit of a comparison between years. The change for most of these is related to cost of living adjustments that were included in the New York State budget. You can see in the last next to the last and the last column there, the zeros that show that where the county dollars are in our contracts. You know, we just have county dollars with the Association for Mental Health and with Liberty House. The other contracts are funded with 100% state aid. But we'll turn things over to Harry, let him walk through how we put together the budget.
Yeah, well, this sheet that Rob was referring to, we did figure in this year we got a 2.84 COLA. So this is the sheet figures it in both into in this current year's budget and contract amounts, and then we projected into 25. And the budget that you have in front of you in the book, we did send in. We were able to do the 25s, but we're still working on trying to get the COLA back into the 2024 budget amounts. Just because the process of doing it in OMH and alcoholism was a bit late in this year in getting their COLAs out. So, but it is calculated in there. And this is a really good summary. And as far as our budget goes, the local government unit, we basically went back and after we submitted our original budget and reduced the personal services by about $5,000 by moving things around, taking things out, and reducing it, reevaluating. So we were able to take about 5,000 out, but you know, the majority, of course, is our salaries and fringe benefits, which is, you know, something that, you know, just resign on the budget and the treasurer's office filled in. So I think about close to 95% of our budget is that. The rest is the OTPS and rental. We do have a contract money in there to contract respite services, well, 65,000. But so it's a pretty straightforward budget because it's mostly state aid and contracts, really. I don't know if anybody has any questions on it.
Anyone from the committee have any questions?
You use the acronym COLA. What does that stand for?
Cost of living, adjustment.
Thank you.
Yes.
Okay, anyone else?
They used to call it a trend, now they call it a total.
Thought we were making a contract with
Whatever, I mean, whatever, they could call it whatever they wanted, put money in.
Thank you.
Okay. Any new business action items? No? Discussion items? Referrals,
Oh, wait a minute.
pendings?
No pending items. I think the only other thing I would mention about, you know, that's probably of great interest is that psychiatric expense.
Got
It's one of those mandated expenses and for the last year particularly, and now this year, it's just been off the charts. So it, you know, we had put in 600,000, but it's kind of up to you, obviously, or the board as to how you want to set that versus how much you might have to take additional out of fund balance against.
Well, yeah, that's our favorite line. We didn't realize before that that's actually a federal program that's pushed to the state. But the one thing we've all had kind of, well, I have personally, I won't say everybody, is what are these tests these people go through to find out if they're competent to stand trial? I mean, it seems to take forever at $1,000 a day, or actually it's more, it's like $1,200 a day. So, I mean, what kind of tests do they go through to find out if they're competent enough to stand trial?
Well, they receive an evaluation from a psychologist to determine if they're competent or not to stand trial. If they're have felony level charges and they're found to be non-competent, they go to a state facility for what's called restoration services. And that's actually like a training curriculum that they go through, where they're educating them and working with them about understanding their charges, the role of the judge, the role of the, you know, prosecution versus defense attorneys. And so they're like training them in all that so that they understand it. But yes, it can take months.
I think that's just one of the things that annoys me the most is the length of how long it takes and how much we're paying state agency to, you know, to do this program. And, you know, maybe it could be done better private sector, who knows? I don't know if we've ever done any kind of look and see how this is transpiring, but just pet peeve, I'm sorry. Rob, you have anything else? Any privilege of the floor? Any comments? Okay, motion to adjourn. Oh, I'm sorry. Oh, well, I thought just for Rob, we'd adjourn. All right, well, you're all set. Thanks.
Thank you.
Thanks, Rob.
See you.
What's better?
Hey, no, I was just looking
Yeah,
at.
I'm
that we
trying to
had-
get us right back on time. Amanda's slowing me down. Telling me I'm doing everything wrong. How was your trip, Mr. Wild?
Amazing. Couldn't be better.
We didn't get any t-shirts or anything.
Mr. Strainer,
Yes, sir.
that, this sheet he just gave us, 24, and it says 25 contract / budgets. When I scroll down to Association for Mental Health, and I go over to the right column at the, it says like, funding and revenues, which one of these columns, I guess, represents the,
Increase?
no, the rehabilitation fee, the 1.2 million to
Well,
rehabilitate,
that was budgeted at 600,000.
right? But is that on this budget that we just got from him?
Should be.
Where is it included in which?
Oh,
is
In
that-
this column?
Is it included in Association of Mental Health, PHF?
It's the only column I can think of that makes sense.
Maybe Amanda can help us.
Okay,
I understand what you're saying. I was looking at the same thing.
On page 24, 23.
24, so it's not on this sheet then.
I don't believe it's on.
Okay,
It's a different contracts they have to provide services.
Contract.
That is a separate.
Okay.
The 4390 is the psychiatric. And then quarterly.
thank you. Twenty-three and 57?
That's like 5%, right? What I thought.
Yes, let's do that.
Review, which is, which was with
This one there, the last page now, right?
No.
Maybe it's this one.
Should be there.
Let's see, which sheet, what's the top sheet?
Budget summary.
Well, good morning, ladies.
I guess, thank you. I'll
Should
find
have
it
it here.
in there. Am I on the wrong one?
Okay,
Oh, there it is. Thank you.
Yep. So
Perfect.
go to the last, there's two there. So
Okay.
go to the last sheet on this one. I know it's not gonna be.
Thank you. Perfect. Appreciate it.
Well. The May,
Something like that.
I'm being kind of. I get it.
Yes, I got it. Okay, two different pages on it.
So this says psychiatric expense criminal.
I have 2 copies. So.
Cause that's,
Okay, we all set? We'll do privilege of the floor again. Anybody have any questions for Janelle or on? Seeing none, go right ahead, Janelle.
So good morning, everybody. Relatively short agenda. With regard to the first 2 resolution requests, I received information as an update. We haven't gotten our official award letter yet, but we've heard from the governor's office and from the Washington County Regional Rep that we should be getting our award letter this week. So I just spoke with Amanda and she's saying that maybe I should continue to ask for resolution 1 and 2 at this meeting. And if we don't get the award letter before finance, we'll pull it. Is that the summary? All right, so resolution 1 is to authorize a contract with the Governor's Traffic Safety Committee for $10,000 of grant funding for a child passenger car seat program commencing October 1st through September 30th of 2025 with automatic renewal unless there's 30-day written termination notice rendered by either party, and to authorize the Board of Supervisors chair in a form approved by the county attorney to amend a contract, authorize additional Governor Traffic Safety Committee funding if available, and approve future contracts from the organization related to this initiative. Health Services recognizes that child safety seats reduce the risk of fatal injury by 71% when used correctly. Health Services will utilize this funding to facilitate our child passenger car seat safety program, which includes community education, outreach, and distribution of car seats to eligible participants. It's anticipated this funding will continue each year and authorization will be needed to ensure there's no interruption in the funding.
Okay, can I have a motion to bring this to the floor? Supervisor Bruno, second Supervisor Gilligan. Any questions? No questions?
I've had personal experience with it. I think it's a very good program. Very important and
I agree.
well done. Thank you.
Okay, so any other questions? All in favor?
Aye.
Opposed? Okay, next, Janelle.
On the second resolution request is to amend the 2024 budget to reflect revenues and expenses in health education program related to the $10,000 grant funding from the Governor's Traffic Safety Committee for the Child Passenger Car Seat Safety Program.
Okay, can I have a motion to bring it to the floor? Yes,
Yes, sir.
Supervisor Wild, second. Supervisor Thomas. Any questions?
Can I just note
Sure,
that there
Tony.
are no general ledger codes, because until we get the letter, Rob Lynch will then create the codes that we will use. So I just use the standard and where we want to put the money in at least. So you've got the account information, just not the actual code.
Okay, any other questions? Okay, call the question. All in favor?
All right.
Opposed? Okay, number 3.
Resolution number 3 is to amend the 2024 budget to reflect revenues and expenses in the disease control program to purchase vaccines and to cover rabies related expenses.
Okay, can a motion bring us to the floor? Supervisor Bruno, Supervisor Gilligan on the second. Any questions? I have one question.
another
What was
good
the
one.
cost of those rabies vaccines again? Was it like $13,000 or something?
If it's
No.
for a person to go get rabies treatment at the hospital, yes, the first one can run anywhere from 10 to almost $25,000 is what they bill. No one ever pays that. And then the second, third, and fourth that they have to get usually can be around $2,000. It's just that first one, Janelle can better explain it. They have to give a little bit different for that first vaccination. So unfortunately, we've had a lot of rabies incidences going on. And if people have insurance, they bill their insurance, and let's say they have a $50 copay, then we get billed that. If they have a deductible, unfortunately, or have to meet that big deductible for the year, because we did have a family years ago that hadn't met any deductible and we got hit with like $8,000. My grant is only for $17,000. And that includes both rabies clinics when you go and get your animal vaccinated. That includes when we send a animal to be tested, and that includes the human vaccine. So 17,000 is not a lot of money. So some does always fall back on the county. I gotta say during COVID, it was pretty quiet and we didn't have a lot of people around, so we didn't have a lot of that. But this year, this whole summer has just been nuts.
And what about for the pre-exposure? What is our vaccine?
And if someone doesn't have insurance, the one thing is I've had two so far that I've been told don't have insurance patients. They get that first one at the hospital, and the hospital is if it's local, has worked with us to give it at their cost. So that's been very good, usually around $3,000 they bill us instead of like 25, obviously. The second, third, and fourth, they come back to the county and we are able to give them their vaccine there at our cost of like, I don't know, it's like $250, $350, something like that for the vaccine. That's just for humans. And like I said, then we do the clinics. And one thing that's good about the clinics too with the animals is it's offset by donations. We ask people $10 donation per animal. They can come in with 10 and give us $10. They can come in with 20 animals and give us $10. We don't question it. It's just a donation. With that donation, we deposit it and that offsets the cost of the clinic, and we notify the state of that. There is a place you have to report that. So, I mean, those clinics help a lot with it. Most of them are covered in full, thank God, with the donations, but sometimes we've only, I think a couple times have we actually made more than what the clinic cost us. That's a whole nother story, but it's just, we've had a lot of bills. And then the big thing is, of course, COVID vaccine is coming up. We went to go order it. We didn't have any funds, really extra funds getting ready for that. We wanted to do about 10,000. So I'm bumping this up for both COVID vaccine and for rabies, the cost that we're gonna have to pay the hospital or hospitals. I should say that it isn't just necessarily our hospital, because we do have someone who went to Hawaii and they didn't have rabies vaccine, so they had to order it. And we had somebody, I mean, they're visiting here. So it happens in our county, we're responsible, but where they go to get treatment, we're responsible. So we've had someone who had to go to Las Vegas for a business trip and unfortunately got 3 here and 1 there. So it gets a little bit cumbersome trying to work without and try to get the discount and get them to bill the insurance and all that stuff. It takes a while.
And this was an abnormally high year too, wasn't it?
This so far, yes. I just got like 4 the other day. So
I think it's another important and very worthwhile program.
Yeah. Oh, yeah.
I mean, we
Okay,
have
any other questions? We call the question, all in favor?
Aye.
Opposed? Okay, number 4.
This is to transfer funds in the 2024 budget.
again, just that in our family health program, whatever, most of that is our children's special health care needs grant, and they need to get supplies, and it automatically it in the budget, it put, because we have salaries in there, it puts hospitalization and dental. We don't charge that to the grant, so I'm moving that money over to supplies where we need it to go. That's all. So that's about $55,580.
All right, motion to bring it to the floor. Supervisor Thomas, Supervisor Bruno, second. Any questions? All in favor? Opposed? Okay. Discussion items?
I'll go over the 2 reports.
Next are our financials, attachment 5 and attachment 6. That was as of September 10th, our current financial status. We're doing fairly well. One good thing is, if you'll notice at the bottom, the salaries, we're at about 50% of salaries for the year when we're already into September, really August. So that's good. We're doing pretty good. If we're at last year at this time, we were at 64%. So some things that were in there, of course, is just in case we needed that for COVID and if we needed to hire. So luckily we haven't had to utilize that. Also, been down in nursing, but we've had 2 new nurses that have been hired since in the home care, which has been great because our revenues are going up there. So we're seeing that increase, which has been really good. Attachment number 6 is again, just they're comparing last year at this time, and you'll get an idea of where we stand. Again, you see the salaries and everything regarding equipment. There really wasn't anything purchased in the past. It was regarding COVID vaccine or COVID grants that we got. So that's why it throws it off. But all those COVID grants are gone right now. They're all finished and done. And then regarding employee benefits, of course, if you get new employees, if you didn't budget for some kind of health insurance, we budgeted single and they got families, we have a little bit of cost increase there, but not much. And the revenues, like I said, are looking pretty good compared to last year at this time. And we just closed August for our home care, and that is up again, which is really good. That's shown with the extra nursing help. That's really helped us.
So now we can jump into our budget. Probably
Sure.
what everybody wants. Attachment number 7 has our budget highlights. What I thought we could do is I could go over the highlights, Ton could go over the summary page and the differential in our salaries. And then if anybody has any questions, we're happy to entertain them, or if you look at it later and have a question, you can let us know. Overall, I think our goal was to decrease our budget for 5%, and I can honestly say we tried. We're coming in about 200,000 over last year of 2024 for the adopted budget. One of our challenges in comparison to 2023 is our staffing. We had a lot of vacant positions that weren't filled until the second half of the year. And so when you're trying to compare, when you're looking at next year, having to fund the position for 12 months where we didn't fund it, for the full 12 months in 2024, that's where a lot of that discrepancy is coming from. Last year, just to kind of remind you, we gave up 9 positions, even after creating a few upgrades. And overall, we saved 478,000 in salaries alone. So I'm sorry I couldn't come in at the 5%. I feel really badly about that, but we did really cut where we could. This year, our goal is with staffing. You're going to see that we are eliminating 2 full-time positions, and we're defunding 1.5 positions in our WIC program. And we're requesting no new positions or no upgrades or anything with staffing. We think we're okay with what we have, and that will allow us to be fully staffed. Yay. It's been a long time since I could say that. Utilizing public health infrastructure grant to update our office furniture, that's going to be a 0 impact, but that's totally grant funded, and you voucher your expenses, and as long as you don't exceed, which we can't, that grant, we should be covered to do what we need to do there. With our home care, we're a smaller agency, but we are fully staffed. We're hoping to see increases, which we've already seen the last couple months, as Ton referenced. And we're going to be focusing on delivering quality care and filling gaps in the community. Public health, our goal is to maximize our state aid reimbursement and seek community outreach and educational opportunities. And we're hopeful with this grant that we did with resolution 1 and 2 with the child passenger seat safety. That's another additional 10,000 to that program. And with WIC, which is flat funded and 100% grant funded, we're working on cross-training our staff and creatively sharing our staff with the WIC program to help address 3 resignations that we got this spring. So jumping into health services, which is also called CHA, which is also called home care. And for those of you that don't know, our CHA is Certified Home Health Agency. That's what that stands for. We're deleting 1 vacant senior clerk position and related fringe, and we're also decreasing part-time salaries and related fringe for a savings of around $66,000. Our electronic medical record, we use DSRIP funding that we had left over to put the new system in place, and we found that it's much cheaper, and we actually are seeing an $80,000 savings, so that's awesome. We had gotten stuck in an older system through a contractual scenario that we couldn't get out of the program, even though we wanted to get out of it, but we finally were able to let that contract expire and go into a cheaper medical record, and we're seeing the benefits of that. And then, you know, we continue to advocate in that program for increased fundings for rates for Medicare, Medicaid, and the commercial insurances to actually pay us what the expenses are for that program. And what Tom likes to remind everybody is that retiree health is about 20% of our CHA costs, which is around $129,813 to be exact. In our preventive program, we're saving $103,442 that was eligible for 28,000 in state aid by deleting one senior account clerk. That position, usually in civil service titles, you have like public health nurse 1, public health nurse 2, 3, 4. This particular title did not have a number associated with it, so that's why I clarified that there was not an assigned number. We're also decreasing the funding for call-ins and on-call. With that program, anything that's above our initial state aid grant, which I think is around 575,000, is 36% reimbursable. So just keep that in mind. With WIC, again, there's no impact because it's totally vouchered and all WIC expenses are covered under the grant, but with our savings, by not hiring and by sharing some positions in our public health side, we're in cross training, we're able to save that program $101,000. It doesn't really affect our bottom line and our budget, but it does help that program spend more money on families and benefits opposed to paying for staff. So, you know, when you talk about the contract negotiations and things like that, and maybe going retro, those funds will come out of some of that savings, hopefully. And I think that's what I had for that. And then moving right along to some of our other programs. On the back of that first page, our family help. We're looking at an estimated program cost of $2,390. A few months ago, we asked to upgrade a part-time position to a full-time just because we had a staff member resign. And it made more sense with a new program coming in using existing staff and making that person full-time to cover those 10 hours of the part-time person that had resigned, or actually she was per diem. What goes through this line is our children and youth with special health care needs program, and the grant is around 56,000. We did seek New York State approval to cover some clerical support and increase salary, the cars, the liability insurance and rent, and they did write back and say that we could do that. So we're hoping to offset that 2,390 with grant funding. That's since I had to update this in August. So staffing, we had no changes from this year to next year, but like I said, we did increase the staff member from part-time to full-time in that program this year. Disease control, we're looking to save $40,526 by reducing our per diem salary expense line and reducing our overtime expenses. We're also looking at offsetting some of our expenses by buddying up with Countryside. They needed somebody to do blood draws, so we're letting them run a nurse, so to speak. So our nurse goes up there and then we're able to payroll distribute our nurses' time to Countryside. And we're actually saving them too because they don't have to hire somebody and pay fringe because they're using somebody that we already have in the county. We are also doing what's called a patient review instrument, or PRIN screen. So somebody that's getting ready to go into a nursing home, they have to have a screen done to see if they're eligible or meet the criteria. And that's a $300 per screen scenario that we get for revenue for each of those we do. We're kind of lowballing it and saying that we're estimating that we'll do 10 a year, but it might be more, it might be less. It depends on community demand. And then also covered in our disease control program are the lead grant, the immunization grant, and the rabies grant that Tom was speaking of. And so that goes in for revenue and expense, and those kind of equal out a little bit. With health education, we have no changes. However, we're anticipating the Jewel settlement funding. Thank you for your support on that. When the funding comes in, it has to be used for specific evidence-based programs. And so we'll be doing the programs that they're dictating that we will do to get the money, but it's good for Warren County and hopefully will affect our health in the community. We're anticipating the grant that we've talked about already with the $10,000 for the traffic safety. And then I just listed some of the other programs we do, and some revenue that goes into that program is our CPR classes that we teach. And all the health education expenses can be billed towards state aid. And if we go over that minimal grant amount, then we can bill at 36% reimbursement. Our bioterrorism program, totally grant funded. I put the grant amount there, but you spend it, you voucher it, and it's no impact. Our early intervention program serves our 0 to 3-year-olds. It's an entitlement program. We have no control over how many referrals we get or what the cost is. I just put worth noting in 2023, we got 251 referrals. We served 218 children at an average cost of $2,385 per child after reimbursement. Staffing, no changes. With reimbursement, we get Medicaid reimbursement, and there's a formula there that your reimbursement equals number of enrolled children in the program. There's a certain percentage there. We also have the EI administration grant where we can put in for some of our staff time and administrative costs. And then we also have expenses that are eligible for 49% New York State reimbursement in that program. Doesn't totally break even. We usually are breaking the bank there a little bit, but we do what we can do to advocate for the kids, but also try to do it in a cost-effective way. With our preschool program, that's another entitlement program serving 3 to 5-year-old children. It's also known as the Committee on Special or Preschool Special Education, or CPSE. It pretty much mirrors the EI program. However, it's run by the school district and the county still pays for that. The biggest issue with that program is transportation. There's one vendor, and unfortunately that rate just goes up and up and up. It's a very expensive contract. We also can get Medicaid reimbursement for that, and our New York State reimbursement rate is 59.5%. And as far as kids that we served in 2023, just to give you a snapshot, it's around 374 children in 2023 at an average of 2,758 costs per child. Some are going to be much less, some are going to be much higher. As far as special grants, I had mentioned in my goals, the infrastructure grant and being able to buy and upgrade office furniture for our staff. And I put in that amount. If you look at the bottom bullet, it gives us the total grant amount for the 5 years, and what you don't use in 1 year will roll to the next year. So I've been working with the furniture people, and I've been trying to get our furniture ordered before December 1st deadline, before it changes to the next grant year. But it's not like some grants where it goes away if you don't spend it. That money does roll. So the total is there. And then I just have my pipe dream of hoping for a garage for the nurses' cars one day, if there's ever extra money, and we can do that. So I'm going to turn the floor over to Ton to go over our budget summary and then our salary overview sheet. And those will be the two colored sheets. The first one looks like this, which is right behind the budget summary title page. And then the other one, if you flip through your packet, is going to be on page 50. It's right before 56. It's actually 53 and 50, or 54 and 55. So both of them have color on them, which makes Tammy cringe, even when she worked in our department. But it made it easier for you to find. So Tom, I'll turn it over to you.
So the summary page is just before page 1, and it's folded, so because we did, like I said, it's got so much information on it. We just, basically what this does, we break down all our department codes in the first column, you'll see. And we tell you what pages they are. We tell you what the appropriations are, which is what we expect for expenses. We break out the revenues. The yellow areas, as you see, are those that are mandated, which is our preventive program, the disease program, our preschool program, and our early intervention program. Those are the 4 of our that we are mandated by the state, and we have to offer those no matter what the cost is. We do break it out by state revenue and federal revenue. One thing which we noted in the highlights is, like she said, we're waiting for the car seat grant. It is not in this budget, but it will be $10,000 revenue, and I believe it's gonna fall under the federal revenue, even though it runs through the state. And that'll be a break even, so that won't affect the bottom line at all. If you go across and over to the column, when you get to the first peach color, I'm gonna say, that's our estimated, we're looking at saving of $312,405 in savings when we talked about all our salary and fringe and call pay and information like that. Giving you the next kind of peach color is what we are looking at with respect to any kind of state aid effect those changes will make. And then the next column with a few yellow lines on it, with the bottom line of 3,199,595. That's what we're anticipating for our budget to be after payroll changes, if they're approved, after state aid changes, if that's approved. So that's what we're saying is going to be our bottom line right now. We're guesstimating for budget for 2025. The pink areas, or the darker pink ones, are just to give you an idea. We've always been asked to show you what was adopted.
Why does
Okay.
that have a minus?
The -3?
Yeah.
One meaning a loss to the county.
Right.
That's the county, because our preschool program, for example, we only get 59.5 cents on the dollar. In pre-EI, you only get 49 cents on the dollar.
Okay.
We never get 100%. And if you go across, like on those two, which are on the bottom, the 1.3 is what we're guesstimating to lose for preschool. And the underneath 494 is what if you go across, you'll see what we actually did lose over the last, either budgeted or actually did lose. And I hate to say the word lose, cost to the county. It is
See on top.
unfortunately on the taxpayers because it is a mandated program.
See on top,
Yep.
small, here it says minus is reduction in.
Oh, that's just under the salary, because like if by putting in minus there, like the first one in there, 66, I'm saying we're taking out salary. But when you go and you do that, that'll reduce what your bottom line will be. So it looks kind of weird, a minus with a minus, but I'm just trying to let you know, just that column only, that a minus is just saying that it's a reduction in the expense that we're anticipating for salaries and
Thank you.
fringe. It does include fringe in that total. But so that is a summary of where we stand with our budget, what we submitted. The next page, which we said the long one, I don't think I need to, but if you want me to go through it, this is the salary summary, what Janelle had said in the highlights. And I color coded, but the first one is all our home care, talking about that we're gonna eliminate a senior clerk position, and that we're reducing our per diem rate in there, that we went from 80,000 down to 70,000. We do have a nurse who's gonna retire and has said she'd like to come back per diem for us. So that was really good. So we haven't really had a per diem nurse in years, which is nice. When I first came here, we had a lady who did weekends all the time, but we just don't get that anymore. 3, 4, 5, and 6 are all WIC related. Janelle and Pat really worked hard at, when people left, at trying to be, what do I want to say? The word is very creative. That's the word I was looking for, of how to utilize.
Forceful.
So we have someone who the position was a full-time position, that was the coordinator. We now are utilizing someone who's worked with them for years, and she's going to do 40% of the time. And that's what the green areas are. So it gives you an idea of what the total, oh, I just realized that didn't print all the total, but on the bottom,
Oh,
that was green.
the others.
Page, it's 50, it's before page 53. It's the next long paper that's folded. Did you find it? I'm sorry. And then our preventive program, again, we talked about a senior clerk position that we're eliminating. Right now, we've hired somebody for one of the positions we had available. We feel at this time we don't need to utilize that position. We also reduced our temp help position and our call pay, which we created during COVID, because we found during COVID, we did not have call pay for like Janelle and Pat. It was a nightmare. We got that approved, but it was too late. They didn't get it. So now within the budget, so we feel comfortable saying we're going to reduce it. Obviously, we hope not another emergency. We'll be back up here, but at least right now we feel we need a little cushion in case there are any emergencies that they need to be called in on. And finally, our disease program. Again, we reduced the overtime expense and we reduced the per diem expense. Now that we have 2 full-time nurses in that program, our per diem, we can back down a little bit. And so we've reduced those. So the bottom line is you'll see on the total there, it breaks it out by how much we expect, which is similar, you were saying about the column for the payroll. There's the $405,000 we expect to save in savings for both salary and fringe. So that's our summary of our payroll that we anticipate. And that's all I have.
Any questions?
Any questions for Janelle?
You both just went through that so slow that I think we fully understand. That's a joke.
I know, I know.
I'm sitting here thinking to myself, you know, in other states, they speak very slowly. That's just how the whole state is. We don't do that here in New York. I'm not picking on you.
Try to get to the point.
Somewhat of a compliment.
Try to get to the point.
I appreciate that.
And then, the only other thing we had under informational items is we have our patient referral tracking that we give you each month. We have our emergency preparedness activities that we give you, the animal bites that we follow up on. In addition to our rabies clinics, our next rabies clinic is October 19th. And I like to give you a copy to post at your towns or to share with your animal control officers. If you get calls or whatever, so that's all I have.
Okay, any questions for Janelle or Tom? All right, well, thank you, ladies. Know how hard you tried to get your budget lower and done a pretty decent job of keeping it where it is, so. Other than that, I guess we can call for a motion to adjourn. Supervisor Bruno, second Supervisor Patchit. All in favor?